So what are we not going to do? Okay. We're not going to keep people who are actually grieving losing their pet or going to lose their pet. It's equally bad in public areas. We want to take them out of the public area and we want to put them somewhere quiet and peaceful where they can be together with the pet. For remember, this is the last time ever. We don't want to wait too long for the euthanasia. So when the owners of the pet say, that's it, can we go ahead with the euthanasia? It's up to the veterinary assistant to get the veterinary surgeon as soon as possible to come to the consult room and perform the euthanasia. Because I'll tell you what happens. Somebody will book a euthanasia for 2 p.m. They won't come probably till 2:30 p.m. because they're putting off coming through the door. At 2:30, they're not going to be ready for the euthanasia. So they may have a talk with the veterinary surgeon. The veterinary surgeon may put a little catheter in the leg, getting prepared for the euthanasia, but it may be 4 o'clock before the family can actually let go. So it always takes longer, or not always, but a lot of the time it takes longer. If the euthanasia is in the hospital, make sure that the pet is presented clean, because it's sometimes very hard for a sick animal not to urinate or lose feces or not to vomit. So veterinary assistants have to be very, very careful to make sure that the owners don't remember their dog for the very last time with blood or vomit around them. And number 4, pushing people out the door, hurrying them along, is why I really said we want a euthanasia appointment earlier in the day. We don't want it last thing at night. We're never going to try and cheer people up. The decision's happened, that's it. Don't try and make people smile. Equally, we're not going to criticize them for saying it was too early or too late. And this can be very difficult sometimes. It's very, very elderly animals that sometimes it can take families a month to decide to euthanize. Some families cannot euthanize. It's just not part of the religion or not part of the family's wishes. And then that becomes a very, very difficult and emotional situation for the staff involved with the animal. And we also have to think of the welfare of the animal. And we talked about that last time. The welfare is important. The most important thing is not to be selfish for yourself as a pet parent, is to think what's best for the animal. We never put a deceased pet into a plastic body bag in public. We all know animals are going to go into bags, just like all humans go into bags when we're dead. But we try not to, or never do it in a public place. And we don't let other people see the bodies of a dead animal. Okay, we just don't do it. Okay, so that was unexpected death. Any questions on that? Okay. Has anybody ever witnessed a euthanasia? No? Mm-hmm. It's both humbling. Sometimes it's a huge relief, not only for the family, but for the vet. And usually afterwards, you look back with pleasant memories as a veterinary assistant and a veterinary surgeon. But it's never easy. Never easy. And it should never be easy. I lost my own dog last year. He was 16 plus. And I still remember it like it was yesterday. And I'm a vet, so it's very, very hard. Anyway, so we're going to go on and we're going to talk about an unexpected death. And this is, I'm going to give you a situation here. there's a young, healthy animal, it's a cat, and it presents for a desexing operation. We call it a spay, it's a female cat. It tests out beforehand, it checks out, I should say, normal. Healthy cat, it's a routine procedure. But during the operation, the cat dies unexpectedly. The vet, the assistants, everybody tries to resuscitate the cat, but we cannot. And the vet has to pronounce that the cat has died. Now, that's one reason that we ask people to sign a consent form. This situation can also happen in human hospitals with us. That's why if we ever have to have a procedure, we have to agree. We have to say, it's okay, I'm going to allow you to give me these drugs. And I understand sometimes there is a possibility, it's a slight possibility that I could die. Okay? Nobody wants this to happen. It's the most terrible situation you could ever imagine, especially with a young, healthy cat. But anyway, it happens. What do? We have to, as quick as possible, let the owner know, because the owner may hear from somebody else. We have to contact the owner. We have to let them know what happened, and all the staff involved has to have a discussion on what actually happened, so everybody understands the same thing. We have to record the circumstances of the death. We do that in our clinical records, and why the records are so important for us. So back to the client, no matter how busy you are, you have to get a hold of the client and you have to tell them, there's bad news, your cat has died. Your beautiful 6-month-old cat has died during the surgery. Explain to the owner what you can and ask them when they can come and see their pet. Just about every owner will want to come and see the pet. Sometimes they may not, but usually they do. And when they do come, we have to make sure that the cat is ready to be viewed by the owner. It's important on your records too that you record what's been said to the owner or what the owner would like. If it's during a surgery, when the animal has actually died, you have to make sure that the surgery looks like it's been finished. There's no blood or antiseptic around. And it's important when the owner comes in to see the animal, the cat looks like it's sleeping. It doesn't look like it's dead. We never put an animal into a refrigerator or a freezer until after the owner has been to visit the animal, if possible. Now remember, I said to you that after death, the eyes open. So what we do try and do in this situation is make the head of the animal lean forward so the eyes will droop down and close. And often the situation, a coin will be put on top of the eyes. With humans, many humans have their eyelids glued together or even stitched together to make it look like the person is sleeping in a funeral home. We want the owner to come as quick as possible, but you have to be prepared that they cannot because they're at their work. And you also have to be prepared for the vet being there when the owner comes, because most of the time the owner will have some questions for the vet. They may not have them all at the one time, but they will definitely have some questions. It's also important that we offer, number 8 here, a necropsy. Now another word for that, and I don't have my whiteboard, I'm sorry, is a post-mortem. Post is Latin, after, mortem, body, death. So an after death, or some people call it an autopsy, but it all basically means the same thing. It's an investigation by an independent person who examines the dead animal to see what it died of. I mentioned at the beginning that there's a lot of poisonings at the moment, or there have been in Poc Fulham and in Sai Kung. And I know for a fact some of these dogs that were allegedly poisoned have had a post-mortem. They've had a necropsy to try and see this time what poison is being used to kill these animals. Okay? The results of a post-mortem can take a long time. You won't get an instant answer usually. It can take a while. When you offer a necropsy, it's important that you record this offer in your clinical records and the client's decision. And this is ever if you need them again, in the worst case in a court of law, at the veterinary surgeon's board, or just to remind the client when maybe they come a month later and say, you never offered me a post-mortem on a necropsy. And you say, well, it's written on your records. So we did. But I think at the time you maybe didn't fully comprehend or understand or want to agree or even recognize the fact that your pet is dead. We'll once again have to discuss the handling of the deceased pet. And we have to make sure the correct company gets the correct instructions about what is to happen to the pet. Once again, we need a receipt. Once we hand over the pet to a company who's going to deal with the dead pet, we need a receipt that they're responsible. And we handle the pet at all times with the utmost of respect. Okay. All right. What do you not do? What do you not do when you've had an unexpected death in a surgery and you're a veterinary assistant and a veterinary surgeon? You don't run away. You don't hide. You don't look uncomfortable. You don't avoid looking at the owner. You may want to avoid questions if you can't answer them. But if you can answer them, you should truthfully answer them. Remember, after the death of the pet, everybody involved has had a team discussion. Everybody's understood what has happened. So everybody has the same understanding of what happened. It may be we don't know the answers to all the questions the owner's going to ask at this time. And usual questions: why did my cat die? What did you do? Sometimes they say it's the vet's fault. Yeah. And I can assure you, there is nobody working with animals that I know. There is no vet I know would ever want this situation to happen to them. But it can, and we must be prepared for it. Okay. Veterinary assistants should not assume that the vet did something wrong. Vets need support through these times. We devote our lives to the profession of caring for animals. So it's very important veterinary assistants support the vets. At Pet Central, we do not insist on payment for the surgery. We're not admitting guilt. It's no liability. We're just not going to insist that you have to pay for this surgery and you've lost your beloved 6-month-old cat in a cat spay. And very important, we don't want to lose, sorry, that's a spelling mistake in my PowerPoint, I must correct that. We don't want to lose the pet by sending it to the wrong cremation company. In Hong Kong and around the world nowadays, there's many companies dealing with cremations and aftercare of pets. There's also in large cities like New York and London, there are vets that only deal with euthanasias because they recognize that it's such an important part of being a pet parent, being there to make sure that you can help your pet leave the world it knows happily, peacefully, as peaceful as possible, and have a gentle death. Okay. So